Avoid dates if you have these health problems. Dates side effects. Dates, the sweet and chewy fruits that have been enjoyed for centuries, are known for their numerous health benefits. Packed with fiber, vitamins, and minerals, these small wonders have been hailed as a superfood by many, from eating it raw to using them in energy bars and smoothies. Dates have found their way into various recipes and have become a staple in many households. But did you know that despite their incredible nutritional profile, dates are not suitable for everyone? That's right, while dates can be a healthy addition to most diets, there are certain health conditions that may require you to think twice before indulging in these sweet treats. In this video, we're going to uncover the common side effects of dates and why you should avoid them if you have specific health issues or while using certain medications. Some of these side effects also occur, not as a result of existing health issues or medications, but rather because of the way some individuals take them. So stay with us, because by the end of this video, you'll have a clear understanding of when to enjoy dates, how to use them wisely to reap their beneficial effects, and when it's best to. I'm going to tell you what to do if you opt for alternative snacks. We'll also reveal what science has to say about the best time to consume dates and how to consume them to minimize the various side effects for those who experience them. But first, let's start with conditions where you should avoid dates. Number 1, diabetes and blood sugar issues. While dates offer various nutritional benefits, they are also high in natural sugars, which can cause rapid spikes in blood sugar levels if consumed in excess. Therefore, if you have diabetes or are struggling to manage your blood sugar levels, you may need to be cautious when it comes to consuming dates. According to the U.S. Department of Agriculture, a single date, specifically the Medjool variant, contains around 18 grams of carbohydrates, with 16 grams coming from sugars. To put that into perspective, that's almost as much sugar as you'd find in 4 regular Oreo cookies. Therefore, consuming several dates in one sitting can quickly add up, potentially leading to significant blood sugar fluctuations. In addition to their high sugar content, dates are also relatively calorie-dense. One Medjool date contains approximately 66 calories, which may not seem like much, but consuming multiple dates can quickly contribute to a calorie surplus, leading to weight gain over time. So, if you are also trying to maintain a healthy body weight, you need to be cautious as well. For individuals with diabetes, these blood sugar spikes can be particularly problematic. When your blood sugar levels rise too quickly, your body may struggle to produce enough insulin to regulate them effectively. Over time, consistently high blood sugar levels can lead to serious complications, such as nerve damage, kidney issues, and an increased risk of heart disease. So, what can you do if you have diabetes but still want to enjoy the sweet taste and nutritional benefits of dates? The key is moderation and careful blood sugar monitoring. Since 2 dates is the normal recommended daily intake for individuals without diabetes, you can reduce your daily intake to 1 if you have diabetes, or cut it out completely if it causes your blood sugar to spike every time. If you are unsure, consult with your doctor or a registered dietitian who specializes in diabetes management to determine how many dates, if any, can safely fit into your individualized meal plan based on your specific blood sugar goals and medication regimen. Number 2. Digestive issues. When it comes to dates, another important consideration is their carbohydrate content. You see, dates are considered a high FODMAP food, meaning they contain specific types of carbohydrates that can be poorly absorbed in the small intestine, leading to digestive distress in some people. FODMAPs, which stand for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, are short-chain carbohydrates that can ferment in the large intestine. Dates contain two types of FODMAPs, fructose, a monosaccharide, and sorbitol, a polyol. When these FODMAPs reach the large intestine undigested, they can draw in water into the bowel and cause fermentation, leading to symptoms like bloating, diarrhea, gas, abdominal pain, and diarrhea in sensitive individuals or individuals with irritable bowel syndrome, IBS. However, it's important to note that not everyone with IBS or FODMAP sensitivity will experience adverse reactions to dates. Tolerance levels can vary from person to person, and some individuals may be able to enjoy small amounts of dates without experiencing significant digestive distress. If you suspect that dates may be contributing to your digestive issues, it's best to reduce the amount you consume or stay away from them completely. Later in the video, we'll look at a proven method shared by medical experts for those that are sensitive to take dates without experiencing these digestive issues. Number 3. Tooth decay and dental issues. While dates are often touted for their nutritional benefits, their high sugar content and sticky texture can contribute to tooth decay and dental issues if consumed excessively or without proper oral hygiene. You see, dates are naturally high in sugars, including glucose, fructose, and sucrose. When you consume dates, the bacteria in your mouth feed on these sugars, producing acid as a byproduct. This acid can erode your tooth enamel over time, leading to cavities and tooth decay. Moreover, the sticky texture of dates allows them to adhere to your teeth and gums, providing a prolonged source of sugar for the bacteria in your mouth. This prolonged exposure to sugar can further increase your risk of developing dental caries and other oral health problems. To minimize the potential for tooth decay when consuming dates, it's essential to practice good oral hygiene habits. After eating dates, be sure to brush your teeth thoroughly and floss to remove any sticky residue between your teeth and along your gum line. If brushing isn't immediately possible, rinsing your mouth with water can help dislodge some of the sugary particles and reduce the amount of time they remain in contact with your teeth. So if you have a history of tooth decay or are particularly susceptible to cavities, it may be wise to limit your intake of dates and other sugary foods. Consult with your dentist to determine the best course of action for maintaining optimal oral health based on your individual needs and risk factors. Number 4. Sulfite sensitivity. You see, dates, like many other dried fruits, usually contain high amounts of sulfites, which are compounds that are commonly used as preservatives to extend shelf life and prevent discoloration. While sulfites are generally safe for most people, some individuals may experience adverse reactions to these compounds, a condition known as sulfite sensitivity. Sulfite sensitivity is more common among people with asthma, with up to 10% of asthmatic individuals experiencing sulfite-related symptoms. For these individuals, sulfites can exacerbate wheezing or breathing difficulty. However, non-asthmatic individuals can also be affected by sulfite sensitivity. So, if you have asthma or suspect that you may be sensitive to sulfites, it's essential to be cautious when consuming dates. If you are going to take them, find ones that are labeled sulfite-free, since not every producer uses sulfite to preserve them. Number 5. People with date or pollen allergies. Although date allergies are relatively rare, some individuals do experience allergic reactions after consuming these sweet fruits. Allergic reactions occur when the immune system mistakenly identifies certain proteins in dates as harmful substances, triggering an immune response. Symptoms of a date allergy can range from mild to severe and may include itching or tingling in the mouth, throat, or lips, hives or a rash on the skin, swelling of the face, tongue, or throat, difficulty breathing or wheezing, abdominal pain, nausea, or vomiting, in rare cases, anaphylaxis, which is a potentially life-threatening allergic reaction. In addition, some individuals with pollen allergies, particularly those allergic to grass, ragweed, or tree pollen, may experience a phenomenon called oral allergy syndrome when consuming dates. This oral allergy syndrome occurs when the proteins in certain raw fruits and vegetables, including dates, cross-react with pollen proteins, causing mild allergic symptoms like itching or tingling in the mouth and throat. If you suspect that you may have a date allergy or experience any concerning symptoms after eating dates, it's crucial to consult with an allergist. They can perform skin prick tests or blood tests to determine if you have a true date allergy or if your symptoms may be related to other allergies. In the case of a confirmed date allergy, the best course of action is to avoid consuming dates altogether. In addition, make sure to read food labels carefully, as dates can be found in various products like energy bars, baked goods, and snack mixes. Remember, while date allergies are uncommon, they can still have serious consequences for those affected. People on certain medications. You see, while dates are generally safe for most people to consume, they can undergo interactions with certain medications, particularly those used to manage blood sugar levels. As mentioned earlier, dates are high in natural sugars, which can cause a rapid increase in blood sugar levels when consumed. For individuals taking medications like insulin or oral hypoglycemic agents to control their blood sugar, consuming dates may interfere with the effectiveness of these medications. If you have diabetes and are on medication to manage your blood sugar, consuming dates in excess or without proper planning could lead to unexpected spikes in blood sugar levels. This can make it more challenging to maintain stable blood glucose control and may require adjustments to your medication dosage or timing. Dates also contain high amounts of potassium, a mineral that plays a crucial role in heart function and muscle contraction. While potassium is essential for overall health, individuals taking certain medications, such as potassium-sparing diuretics or ACE inhibitors, may need to monitor their potassium intake more closely. Consuming dates in large quantities alongside these medications could potentially lead to elevated potassium levels in the blood, a condition known as high potassium hyperkalemia, which can affect the kidney and heart. Therefore, if you are taking any medications, particularly those related to blood sugar management or potassium regulation, or you have kidney or heart disease, it's crucial to consult with your doctor or pharmacist before incorporating dates into your diet. So, what is the best time and way to consume dates to maximize the health benefits while minimizing or eliminating these side effects? First, you need to consider the timing. You see, there's no universal best time to consume dates. The best time may depend on your individual health goals and concerns. For those with diabetes or blood sugar issues, it's generally recommended to consume dates as part of a balanced meal that includes fiber, protein, and healthy fats. This will help to slow down sugar absorption and minimize rapid blood sugar spikes. For such individuals, you should also avoid eating dates on an empty stomach or as a standalone snack, as this may lead to more significant blood sugar fluctuations. However, if you do not have diabetes and you are not at risk of diabetes, consuming 2 dates first thing in the morning is actually recommended. Now, for people with digestive issues like IBS or FODMAP sensitivity, consuming dates in smaller quantities and spreading them out throughout the day is more advisable and better tolerated than eating a large amount in one sitting. Then, there's how to consume them. Experts have also recommended soaking dates overnight, 8 to 10 hours before eating them. This is because dates, being a true dried fruit, contain a very low water content. By soaking them, it makes it easier to absorb the nutrients from them, while also reducing digestive issues for those who experience them. If you forgot to soak them overnight, you can also soak them for 10 to 20 minutes in warm water before eating. If you want to learn about the numerous benefits of dates, we have a different video where we discuss that in detail, linked in the description. So, what about you? Do you like dates? Have you experienced any weird symptoms after consuming them? How often do you eat them? Also, what benefits have you noticed from consuming dates? Share with us in the comments section below. If you enjoyed the video, don't forget to like the video, subscribe to the channel, and hit the bell icon so you don't miss out on the next video.